Thank you, Dr. Brimaraj, for inviting me here. I'm very privileged to have the opportunity to speak. I'm Jeanette Ferrer, and I'm actually the medical director for the supportive and palliative care team. Every day, I spend time with patients and listening to them and listening to their families and their needs. And I'm grateful for this opportunity now to be able to stand before you. Before I go on, it looks like we've got some questions that I'd like to engage you in. With the first question being, how did you feel when you were diagnosed with heart failure? If you can all take your responders here and answer A, depressed, B, hopeless, C, confused, D, overwhelmed, E, none of the above. Guess I wish there was also an option that said all of the above. No. That's an interesting distribution. Be the least amount of the hopelessness, but there's a lot depressed, confused, overwhelmed. I wonder, the none of the above respondents, would it have been better if we had put in all of the above? Is that what? Okay. Second question is, how do you manage stress? I eat away at my feelings. I talk to someone, friend, loved one, family. What? Never stressed. I exercise, or E, none of the above. Well, there's quite a few of us here that are never stressed. We've got 3%. What did we convert that to? One person? I'm not going to ask you to raise your hand. Who said that? But as you can see, that there are those of us who admit to having stress, and my presentation today is going to address some of these feelings, these emotions, and the symptoms that you've all experienced with a diagnosis. As I was saying before, I usually spend my days listening to patients and allowing them to talk, allowing families to talk. So now that I've got a chance to talk myself, I'm actually going to take advantage of this and talk a little bit about my service. The supportive and palliative care team, basically this is what we do, is we support. We provide support, whatever that may mean. We support the patient, the family, the team, the medical team. We can either provide guidance, counseling, education about whether it's just logistics of being in the hospital, whether it's about the clinical diagnosis, whether it's about the actual process of the disease. Lots of times when you have multiple members of your team that's helping provide your medical care, there's a lot of moving parts, and sometimes there are gaps in communication. Our team actually helps fill in those gaps and try to smoothen the process and try to ensure that we communicate as best as possible. And then we are specialists in comfort and advanced symptom management. What I present to you is a slide that has some of the more common symptoms that our heart failure patients present with. Now, what I'm not going to do, and if this is what you expected, I apologize, but what I'm not going to do is present you with a list of slides and then present you with a slide of treatments. And that's not my intent today. What I'm hoping to do is to be able to show you the list of symptoms and then give you a recommendation on how to proceed with approaching those symptoms and how to best deal with them. So again, we've got fatigue or tiredness, coughing, dyspnea or shortness of breath, chest pain, nausea, dizziness, swelling, all symptoms that our heart failures experience pretty frequently. Now, as far as your symptoms, I do think it's really important, and as Dr. Brimaraj and Dr. Park and Dr. Brewer had stated, it really is important to address what happens at home, what happens outside of the hospital, what happens outside of the doctor's visit. My recommendation would be to keep a log of some sort where you log your symptoms And whether it's shortness of breath right after going up one flight of stairs, or swelling of the legs immediately after eating that large serving of McDonald's French fries. And then rating them 0 to 10, 0 being no symptoms at all, 10 being the worst that you've ever felt in your life. Keeping a log of this and then being able to bring it to your doctor's appointments and sitting down with your medical team to discuss exactly what's happened in the time since your last visit can give your medical team a better idea of what's going on at home, about what the causes are of those symptoms, and be able to formulate a plan personalized to your particular situation at home, and thereby hopefully maximizing the possibility of a good outcome. So I move on to recommendations about dealing with the diagnosis, and as we saw in that last slide, we've got quite a few emotions and symptoms that we all experience when the diagnosis of heart failure is rendered. And as we observe too, it seems like everybody experiences some of these symptoms at one point or another, and sometimes all at once. And so how are we going to deal with that? I'm going to make some recommendations based on some conversations that I've had with my patients, and of course, as well as with Dr. Brewer. His testimony had helped me formulate a lot of what I'm about to present to you. And so I lay before you 3 different divisions here in my presentation: educate and empower. And that's a pretty common theme that you've been hearing since we started this morning: the empowerment and the education, gaining the knowledge. Engaging and exercise. And before you all start groaning, when I refer to exercise in this, it's not physical activity exercise. It's actually exercising your right to knowledge. And then expectations and expectations. And so to educate and to empower, a lot of what those emotions that you were feeling when you received the diagnosis or your loved one received the diagnosis was, as Dr. Brewer stated, a loss of control, facing the unexpected, facing the unknown, not knowing what's going to happen next. Taking the steps that you all have by coming to this conference today shows that you've already taken some pretty major steps in educating yourselves and empowering yourselves and starting this process of dealing with the diagnoses. And so furthering that attainment of knowledge can lead to better coping with the diagnoses and allow better, stronger empowerment. Engaging in exercise, engaging in the process, engaging in the treatment that you're being provided with, engaging with your team, with your support system, exercising your right to know what's going on. That's what I've encouraged here. Know who your support system is. And that may include family, that may include friends, it may include social resources, churches, fraternities, sororities, clubs. Identify who those support people are. Ask questions. Identify exactly what it is that they can provide for you. Identify for yourself what exactly your needs are so that you may also activate your support system. Know who to turn to for help. A lot of your interactions are going to involve you and your physician or you and your nurses, but know that there are multiple people that you can turn to for help. Here, our system here at Methodist includes the social workers, includes the physical therapists, the occupational therapists, the chaplains, the supportive team, the front desk clerk. These are all people that you can turn to ask for help. And it may not be a clinical question that may be bothering you at any moment in time. It may be a financial question that we can guide you to the billing people. It may be an appointment logistics that the front desk clerk can help you. You don't have to save all your questions for the doctor who may, a lot of times, I have to admit, we may not know the answer. And so knowing who to turn to for help can help you maneuver through the system and be able to cope with some of the stressors that you experience when dealing with the treatments that you undergo. Again, ask questions. Don't be afraid to ask questions. Regardless of whether you feel pressed for time or logistics, I encourage you to ask questions. And if the person that you ask who may not be aware of what the answer, we're always willing to try to get you to the right resources. And then know that you're not alone. It's easy for people when they get the diagnosis to withdraw, to isolate themselves and use that as a coping mechanism. As you can see here, just the presence of about 200 registrants today tells you that you're not alone in this. And I think the number was 22 million with this diagnosis in the nation. There are a lot of resources out there that you can take advantage of. Ask who you might be able to touch base with. In my experience, a lot of patients and their caregivers who are undergoing similar processes are willing to share their experiences, willing to share their pearls of wisdom that they've attained. And so just asking to maybe your physician or your nurse for contacts and how to reach out to people like this, whether via support group or one-on-one, you may be able to incorporate them into your support network and gain some additional knowledge that could be helpful. Expectations and expectations. In my experience, things fall through the cracks. People may become dissatisfied with the services they're receiving because of mismatched expectations. As a member of the medical team, we do try to make clear what our expectations are of our patients. The expectation to take their medicine, the expectation to follow a diet, the expectation to make their medical appointments. But try to engage in that conversation to ensure that you understand what their expectations are, but also, I emphasize, make sure that your medical team understands what your expectations are as well. Maybe your expectation is that somebody will be available 24 hours a day to answer that phone number that you've been given. Maybe that your expectation is to have appointments readily available on the weekends after regular business hours. Make sure that you communicate this. I can't promise that what your expectations are will be met, but the first step towards that would be to engage in that conversation, ensuring that both patient and medical team are aware of each other's expectations. The treatment plan. The normal course is you go, you see the doctor, you tell them what's wrong, you get a prescription, you may get additional services, referral for physical therapy, or maybe even home health. How many of you are guilty of nodding yes when the doctor's talking and really having no idea what they said? It happens very frequently, and unfortunately, what could potentially happen when you go home is then you don't follow what the instructions are, and there may be adverse outcomes. And so take that time to make sure that you understand. Ask the questions. It's important that you understand what the treatment plan is, and then also communicate back what limitations there may be. Whether it may be a financial limitation, maybe your insurance company doesn't cover the medication that they're prescribing, maybe it's not available at your pharmacy, maybe you don't have transportation to make it to once-a-week visits. Whatever those limitations are, don't be ashamed to bring it forward. We've got a lot of resources that may be pretty simple to address those limitations. What's important is that we understand where you are and try to meet you wherever it is that you are and try to accommodate those needs. And we would rather make the effort to do that rather than you choose not to take your medication, rather than you choose not to make your medical appointments and have adverse outcomes because of that. And so again, I encourage you to communicate with your team and engage them let them know about your limitations and what your expectations are. Before I go to that, I just wanted to bring up that slide of stress. We're all going to experience stress through this whole entire process, and different people have different ways of coping with the stress. Family and friends, reaching out to them. I think that was the number one answer that was brought up in that slide. Some seek counseling, some meditation. There's art, music, pet therapies as well, and hobbies. There's going to be a presentation up and coming here that will focus a little bit more on these in detail, but so I'm not going to belabor this. But what I want to impress upon you is that it's a very personalized choice, and you have to ask yourself what exactly it is that you use to relax and to deal with stress. Sometimes that stress is because you're expecting yourself to reach the level that you were at prior to the diagnoses. One of the things that I want to emphasize is that you may need to establish what I call a new normal. Gauge your progress of your treatments based on this new normal, not on the normal that was prior to the diagnoses. This concept may allow you to get a better understanding of where your treatment therapies are going and prevent you from balling up and isolating yourself. So the concept of a new normal, I encourage you to think about that, about what that is, and maybe gauge your progress with your treatments based on whatever that new normal is. And I'm going to leave you with this last slide because I don't think we give ourselves permission to ask ourselves what the answer to this question is. I think we hold ourselves to a standard of what society expects, of what our family expects from us, and we try to comply with all of that. But I don't think we spend enough time asking what is it that makes us happy? What is it that will allow us to feel happy about our situation, and then indulge in that. And so I'll leave you with that as a question to ponder and ask yourself. Give yourself permission to answer that question and maybe pursue that and indulge.